knowledge of their internationalization, expressing not motives and IT role. Now let's talk about the problems. Chinese tech companies' growth but global influence compares to international ones. Distinction internationalization theories count experiment on global farmers' fast growth. Also, there is little recession on Chinese-born global manufacturing companies, so we need new theory for Chinese context. Next is about object of my study. I am there to find out why Chinese-born global manufacturing companies internationally like market of innovative reasons. I explored their presence stamp. I also investigated IT importers on their business and wanted to build a theory for summary fail. Let's talk about how I did my research. I did raw software for 20 something, get 937 samples, sent one surrogate and 14 questionnaires, and had 988 valid responses. Questionnaires has basic info and a 5-point Richter scale. I also conducted online data. I use this comparative factor analysis and now for data analysis. Now let's look at the result and the description. The KMO value of 0.949 was good for factor analysis. There was a strong link between Chinese business and the IT involved global internationalization. My found different for Chinese literature. I found high profit and pressured the police as you motives related to Chinese situation. Finally, let's talk about conclusion. Chinese-born global companies of international to avoid domestic competition, get technology and increase reversion. Thanks for the increased connections, scale, knowledge, strategy. My research helped understand their companies and contribute to service. Thank you all for listening. Thank you.
Thank you, Jean Yuan, for your presentation. Any questions from the floor? Anyone have any questions from the floor? So can you go to the objective of your study?
I need to find out why Chinese-born global manufacturing companies international like market of innovation reasons.
So your title, you start to understand that you are studying the information technology in question. So your title, maybe you need to rethink, because maybe you can refine it, because it's quite not clear in the title. What do you mean by question here? A study of the information technology in question. So please check on the title. So how do you think or what is your opinion on the outcome of your study? How you said that it's going to benefit some Chinese businesses, right? You mentioned that a number of Chinese businesses. Can you specify on that? Like, what is the benefit of your study to the Chinese business?
I research it because we lack knowledge of their internationalization, plant marketing, and IT role.
Okay, can you repeat the answer? Sorry, I didn't get you. Can you repeat the answer?
Can you repeat once more?
Read again.
Read it again, yeah.
I focused on Chinese manufacturing once, with Chinese growth understanding that is key. I researched it because we lacked knowledge of their
International business. Okay. Okay, thank you for the answer.
international.
Thank you, Ms. Jin Wen. Okay, next presenter, I would like to call Ms. Lee Yong Mao. Please welcome. Mr. Sorry.
Good afternoon, everyone. I'm Li Mao. I'm from China. My title is to extension to extend the development of an addition Malaysian salmon for Asian kidney. Plumbing and the ecology and culture are so initial education set application they discourage US education models to expose the person and the people it is my effective EMIS selection of the from how come condition action medically enhancing the and is education of addition that is made by EMIS. Ability of assess the station primary goal is to is in the evaluation of EMIS. Additionally, the sophisticated the information of patient in market is of addition data and the given currency the can evaluation advanced on the automation. comparison every work. Edition time episode in economics explains. Edition pension debt. Ladies, is the it is the current space key. Data that means that the students information as past data transcript comprises praise the student machine as to EMIS and everything display results EMIS. Awaiting in EMIS is the official audition date leading the board of edition collection and movie this Alice. Awaiting the recent shop edition EMIS edition collection my edition edition. What can edition be? Clause and it is the same. Thank you very much.
Congratulations, Mr. Lee Yong, for your presentation. I have a few questions regarding your research. First thing first, I would like to know about what is sense-making perspective. Could you elaborate more on this sense-making perspective?
The student printing goes to the evening of EMIS and the capability of catching multitude and the indication data small. Yes.
Let's move to maybe I would like to know more on your research design because I couldn't find in here your sample population because this is an education system. So what is actually your sample population and could you elaborate more on your research design? Because it's not in here, right? Could you elaborate more on the research design? Who is actually your subject and then how you actually distribute all these questionnaires when this research has been conducted. So could you elaborate briefly on this research design, your research? Thank you.
Yeah. The unison of about how person understand even and promoting within bodies within option of EMIS to being a subtem edition smart.
Right. So during these questionnaires, you distribute to who? To teachers, students, the policymaker. So these questionnaires that you distribute in your research to who?
Oh,
This is the sample.
This brings scope that MEMIS can help many more.
System, yes, this system, student or teacher?
Student. Thank you very much.
Thank you for the presentation. Can we have the next one?
Okay, thank you, Mr. Lee Yong Mo. Next presenter, I would like to call Mr. Muhammad Mahmudul Hassan. Please welcome. Here. Okay, maybe we can call next presenter, Mr. Al Rashidi Nasir. Please welcome.
Assalamu alaikum. Good afternoon, everybody. In the beginning, allow me to introduce myself to you. My name is Rashidi Nasser Ayed. I'm from Medina City, Kingdom of Saudi Arabia. My topic is about effectiveness of the transformation leadership to improve work environment and nurse satisfaction with a systematic review. Introduction: the role of nursing profession cannot be overemphasized, as nurses play a critical role in healthcare service delivery and comprise the most group of healthcare workers. Beyond providing direct care to the patient, nurses also interact with family members or caregiver related to the patient under their care. They educate patient caregivers and community members about lifestyles that facilitate recovery from illness and maintain healthy lifestyle behaviors. This is about introduction. Then, continue introduction. The recent years, leadership style and job satisfaction have become important issues in the healthcare system. Various nursing leadership styles have a direct or indirect impact on the nursing profession and the quality of patient care. Transformation leadership has become one of the leadership styles believed to have a positive effect on nursing job satisfaction, work environment, and performance. The definition of the transformation leadership is the leadership style where leaders inspire, motivate, and encourage others to innovate and create change that will help grow and shape the future success of an organization. It emphasizes the importance of vision, inspiration, intellectual stimulation, and individual consideration to foster high level of commitment and performance among others. What is the objective? The objective is the review aimed at assessing the effectiveness of the transformation leadership style to improve work environment and job satisfaction among nurses. Methods: comprehensive literature search were conducted in Medline Center, Web of Science, and Research for Life. All English articles published between 2019 and 2024 reporting the effectiveness of the transformation leadership in work environment and nursing job satisfaction were eligible for inclusion. Prisma guideline was used to select cross-sectional study for this systematic review. These, as you see here, about the total articles were 243 after duplication removed and screening. The studies only included 5 articles. Here, a cross-sectional study critical appraisal tool used to assess the appropriateness of using cross-sectional. Here, the 5 articles was conducted in Portugal country, Turkey, Jordan, and Kingdom of Saudi Arabia, and Pakistan. All the study was a cross-sectional study. Then the findings was all they are shared in a positive correlation of the transformation leadership on job satisfaction and work environment. The result: 5 articles were included in the review cross-sectional study. These studies were conducted in a healthcare setting with a total of 1,285 nurses, and they reported the positive influence of a transformation leadership on nursing job satisfaction, work environment, and quality of care provided by nurses. Discussion: this review revealed that all studies affirmed a positive correlation between transformation leadership and nursing job satisfaction. Transformation nurses need both stability to identify and anticipate the needs of their nursing staff by fostering a strong relationship and actively working to address this need. This approach promotes a sense of empowerment and autonomy among nurses, which can ultimately lead to increased job satisfaction. Limitation. The search for literature was limited to articles published from 2019 to 2024. Additionally, studies published in language other than English may not have been included. This limitation can affect the interpretation and reporting of findings. Conclusion: the transformation leadership style significantly enhances job satisfaction among nurses. Consequently, it is advisable for healthcare organizations to adopt a transformation leadership style to improve work environment and nurse job satisfaction. And this is my address, and thank you.
Thank you for the presentation, Mr. Al-Rashidi. So, can you explain the role of transformational leadership in the clinical setting of nurses? Examples.
You see, there are so many types of leadership style. One of them, or the best one, is a transformation leadership. Especially in our country, in Saudi Arabia, now transformation style, now it is adopted and very important from the government and Ministry of Health. Because the role about the transformation leadership, the leaders who inspire and motivate the followers or the team members to share in organizational goals. Also, they reward him when they are making something with goal. They are reward him when they are adopt this style. All members they will increase their job satisfaction, so they can do or they can do something that will be something for organizational. Also, they are when the nurses, especially in nurses, as you know, 90% of any organization, the nurses who are the workers. So when you gain, the nurses are gains their satisfaction, the organization will achieve their goals.
Okay, may I know why you have to investigate this? This is an already existing type of leadership, right? So, what is the reason for you to study this?
Okay, in our country, in our country now there is so many rules are changed. For example, in our primary healthcare centers, we are working only one shift in the morning. After that, there is one new law to work 24 hours. So the government adopt something. One of them is a leadership, transformation leadership to increase job satisfaction of nurses. When the nurses are in gain job satisfaction, they will work is better. So they will work about 24 hours as they are working one shift.
Congratulations, Mr. Al-Rashidi. I just have two questions. I'd like to know about your design because in here you are using Prisma, right? So I'd like to know more on what keywords that you use that actually will lead you to only 5 review articles that you review because it's quite a few numbers, the article. And then another question is, this is the article that you actually put in your review is more to cross-sectional study. Is there any specific reason you only choose cross-sectional study paper?
Yes, I used the Prisma guidelines. Then 243, as you see the article, why it is the total. But after duplication removed, after making the screening, some there is no efficient idea or information. So that when the included the finally will become 5 articles only.
May I know what keywords that you put in your search?
Yes, I searched that the transformation leadership effectiveness only on job satisfaction. I found some, but I need specific to nurses. That's why. Thank you.
Okay, next presenter, I would like to call Mr. Fahad Munasir.
Yes. Hello everyone. My name is Fahad Al-Anazi. I'm from Saudi Arabia. My literature review talking about the effects of transformation leadership in job satisfaction and quality of care among nursing managers. Background. The debate of the fact of the leadership style in job satisfaction and quality of care is related to the style and the nurse working environment and healthcare quality of provide. Therefore, the current literature review examining the effect of transformation leadership in job satisfaction and quality of care among nursing managers. We're using the method for literature search for was FibMed and Midline and Singhal and EBA Cycle Info and Global Search. All the study was published from 2018 until 2024 in English language, and they report effects of transformation leadership, module and job satisfaction and quality of care among nursing were established as eligible study. Finally, 8 studies were included in the literature review. All the studies were study using cross-section design. All the study report positive effect of transformation leadership and job satisfaction and quality of care. Conclusion: the adapt for transformation leadership style by nurse manager and potential improve job satisfaction and among for nursing manager and staff members. It also contribute to the quality of care at 6 areas. Thank you.
Thank you. Thank you for the brief presentation.
It's only 3 minutes, that's why.
Why 3 minutes?
They told me 3 minutes, that's why I make it like 3 minutes.
Is that so? 3 minutes?
Yes.
Yes.
Okay, then I think you can explain the results because the result part is not found in the slides. So
Yes.
you explain your findings of the study.
Yes, this is a real study for job satisfaction, and now we are looking for the, all the staff and nursing now they are in burnout, and they're looking for satisfaction and give the patient for good care and improvement. That's why now our study for using the transformation leadership style to improve the nursing.
What is the findings of this review? You have made this review, right?
Yeah.
What is the findings? What is the results?
What the result we are finding is we're finding effect for like a positive effect transformation for leadership for satisfaction and quality of care. That's why we are. This is the result.
Okay, you choose 8 studies, right?
Yes.
So 8 studies will have the individual results, right? Which is like
Whether it is showing a positive correlation or not, right?
Yeah.
so when you analyze analyze those articles, it should give you, you should have to come up with your own findings. So when you say that it's positive correlation, yes, that is summary of what you see. But I think the results part has to be more detailed, right?
Yeah, because still I didn't finish. Still I'm in proposal. That's why I'm looking to. I have to finish day and Friday about this one and complete for all this. And I have more slides, but still I didn't finish it because they told me 3 minutes. That's why I can't put everything. That's why I make it short. That's why.
I don't know, maybe whether you understand the question. So when you perform the reviews, so that's the statement you mentioned just now is all have a positive correlation.
Yes.
That is the individual result of the particular study.
Yeah.
But when we are doing the systematic review, your own findings should be based on the individuals. That means after reading all those 8 articles, you will have some points to discuss, keywords, some points to discuss. So that has to be the framework of your discussion. So it's okay, fine. Maybe you can improve that now.
Yeah, thank you.
Okay, thank you for the presentation.
Thank you.
Okay, next presenter, I would like to call Miss Susilawati.
Good afternoon, Honorable DSA and Dr. Galia. Thank you for giving me time to present. I will present my article is factor influencing the risk of anemia among pregnant women in Sukabumi and Center Malaysia. This is my overview. Introduction, object, method, discuss, conclusion, and reference. Anemia is a common and widespread global health issue affecting around 56 million women worldwide, with 2/3 of them in Asia. The impact of anemia during pregnancy can affect both the fetus and the mother, especially in the third trimester. Anemia can cause complications such as premature labor, antepartum bleeding like placental abruption and placental previa, intrauterine growth restriction, and intrauterine asphyxia that can lead to death. Additionally, in newborn, maternal anemia can cause low birth weight and asphyxia. There are various factors that influence the risk of anemia in pregnant women, namely nutritional status, socioeconomic status, frequency of ANC visit, frequency of pregnancy, interval between pregnancy, consuming of iron tablet, education level, and age. This study aim to determine the factor that influence the risk of anemia in pregnant women. This table of research use a correlation with cross-sectional approach. The population sample were 80 pregnant women at Sukabumi Community Health Center working area using total sampling technique. Data collection technique was questionnaire. Data analysis used univariate analysis with frequency distribution and percentage of each category. Bivariate analysis using chi-square test and multivariate analysis using logistic regression. This is the result of bivariate analysis with the chi-square statistic with a p-value of each variable less than 0.05.
And this is the result of multivariate analysis, so that there are X variables significantly associated with the risk of anemia multivariate logistic regressy with the risk of anemia in pregnant women with an OR value of 181.820. Uh, Impact of nutritional status on risk of anemia in pregnant women. Uh, the study found that for nutritional status in pregnant women increased the risk of anemia by 6.750 times compared to those with excellent nutritional status. Effect of socioeconomic status on risk of anemia in pregnant women. The chi-square statistical test reveal a significant effect of socioeconomic status on the risk of anemia in pregnant women. And pregnant women with low socioeconomic status have a higher risk of anemia with an odds ratio of 10.667. Effect of frequency of INC visit on risk of anemia in pregnant women. Pregnant women who attend ANC less than four times are at 21.71 4 times higher risk of anemia. Effect of gravida on risk of anemia in pregnant women. Multi-gravida women have 12.667 times higher risk of anemia compared to pre-gravida women. And effect of pregnancy spacing on risk of anemia in pregnant woman. Pregnant spacing and the risk of anemia in pregnant woman. Women with pregnant spacing of sorry. Uh, this test square, the test square statistic test found a significant relationship between pregnancy spacing and the risk of anemia in pregnant women. And effect of iron tablet consumption on risk of anemia in pregnant women. The test square statistic test result indicate a significant relationship between FA tablet consumption and the risk of anemia in pregnant women. Pregnant women with non-routine FA tablet consumption have 7.719 times higher risk of anemia compared to those with routine FA tablet consumption. Effect education level on risk of anemia in pregnant women. Pregnant women with primary and junior high school education have a high risk of anemia. Then those with high school education. Effect of age on risk of anemia in pregnant women. Pregnant women who are at risk have a risk of anemia that is 30.143 times higher than those who are not at risk. Simultaneous effect of nutritional status, social economy, status, frequency of ANC visit, frequency and spacing of pregnancy, FT tablet consumption, education level, and maternal age on risk of anemia in pregnant women. The study revealed a significant relationship between the risk of anemia in pregnant women and factors such as nutritional status, social economy, frequency of ANC visit pregnancy, FA tablet consumption, education level, and maternal age. The nutritional status variable is the most dominant, with poor women at higher risk of experiencing anemia. Poor nutritional status also contributes to chronic energy deficiency and fetal growth. Conclusion, the results show a simultaneous influence between nutritional status, socio-economic status, frequency of INC visit, frequency and spacing of pregnancy, consumption of F tablet, education level, and maternal age on the risk of anemia in pregnant women with the variable of nutrition status as the most dominant factor affecting the risk of anemia in pregnant women. Thank you.
Congratulations, Mrs. Lavati, for your presentation. This topic, I think anemia, it is well established about anemia topic, right? There is factors that influence anemia. So I would like to know why you actually interested in doing this topic, because it's well documented about the risk factor of anemia among pregnant women.
Okay, thank you, Doctor. Because anemia in pregnant woman, the high incidence of pregnant anemia in pregnant woman. Because anemia in pregnant woman is generally a form of relative anemia caused by physiological changes in the body during pregnancy, such as hemodilatation. And the global prevalence of anemia among pregnant women is 41.8% of the total number of pregnant women.
How about in Sukabumi, you have high prevalence of anemia?
Sorry, Doctor.
The incidence of anemia, is it high in Sukabumi?
Yes.
And do you know any policy that have been actually applied on your area? Is there any? Your Christmas, do they have any intervention to actually reduce these anemia cases in Sukabumi?
Because maybe the result for this study for Christmas, maybe the result of this research can be a basic providing education to pregnant women, as especially in reducing risk factor that influence the incidence of anemia in pregnant women. Thank you.
Okay, next presenter, I would like to call Miss Nina.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Thank you for your time. Thank you to me, and today I will present our research that will contain of characteristic, genetic history, nutritional status, knowledge, and stress level on the prevention behavior of type 2 diabetes mellitus in University Indonesia and Indonesia Maju student. Situation of diabetes mellitus in Indonesia for the university student is 12% of university students are at high risk due to obesity, family history, and unhealthy diets. 10.89 diabetes prevalence in the 15 and until 48 age group. Okay, risk factor of university student is first is sedentary lifestyle and lack of physical activity, increased fast food consumption, poor awareness and documentation of diabetes prevalence among university students globally.
Nanti Pipit tunjuk tangan.
The vulnerability of college students is lifestyle transition is changing in the habit during higher education increase with TDM risk, unhealthy diet with the high sugar and fat consumption, irregular physical activity patterns, academic stress leading to unhealthy coping mechanism, and poor sleep hygiene and irregular sleep patterns. The objective of the research is analyze the influence of various factors on TDM prevention behavior, provide evidence-based recommendation for intervention to change to TDM prevention among college students, and identify the most significant factor affecting the patient behavior. The research gap of the research is based on the above background. The problem formulation in this study is as follows: how the influence of gender, genetic history, nutritional status, knowledge level, and stress level on TDM prevention behavior in college students. What factors are the most dominant in influencing TDM prevention behavior in college students? How intervention effort can be made to improve TDM prevention behavior among college students? The finding of summary. A significant influencing factor on the TDM prevention effort. Men are more likely to have poor TDM prevention effort compared to women. Two, having a genetic history of TDM increase at the risk of poor prevention effort. Three, individuals with the normal nutritional status are at the higher risk of the poor prevention effort. Four, low knowledge about TDM prevention significantly increases the risk of poor prevention effort. And four is high stress level correlate with the better prevention effort, indicating a complex relationship. Knowledge level is a dominant factor identified as the most dominant factor influencing to TDM prevention effort. The implication of the study first is importance to health education, emphasize the need to comprehensive health education to improve knowledge about TDM prevention. For the stress management, highlight the necessity of effective stress management strategy in the diabetes prevention. And encourage the adoption of healthy lifestyle, particularly of students who are overweight or have a family history of TDM. The study suggests a need for a comprehensive approach to TDM prevention that includes health education, dietary promotion, physical activity, and cure and the stress management. A study has significant the limitation of the study. First is a study had significant gender imbalance with 88% of respondents being a female. Two, the study's cross-sectional design limit the ability to establish causal relation between the variables. Three, the study focused on a student from a single university, which may not represent the broader population. Factors such as socio-economic status, cultural background, and access to health research can vary widely across different regions and demographic potentially. Four, other confounding variables that may influence the prevention effort, such as socio-economic status, physical activity, level, and access to healthcare, we are not controlled for in this study. This factor could be significantly impact the result and should be considered in the future research. Based on the research, scope of the future research is develop and evaluate targeted intervention program aimed improving genetic, nutritional knowledge, stress management, and explore the role technologies such as mobile health application and online education platform. Thank you.
Thank you for the presentation.
Okay.
Thank
May I check your title? says that characteristics, genetic history, nutritional status, knowledge and stress level on the prevention behavior of type 2 diabetes mellitus in Universitas Indonesia Maju students, right? So just now you mentioned that gender is there. So is it one of the factors?
It's the one of factors.
So is it it's not included here, or is it the word characteristics? Does it mean it is in?
The characteristic is mean a gender.
Okay. I find that title is too long. It's going more than 22 words. Maybe you can consider that. In your further study. Another question.
Thank you very much and congratulations, Ms. Nita. I'd like to may I go to your limitation?
Yang pertama tadi di mana ditaruh foto busnya?
Because this one I think I found that this is more to internal validation, right? So I would like to know how to actually do something like that.
The population of the study is the study of the public health in the University of Indonesia Maju. It's I use the sample size determinant using Lemon-Shaw rumus, and they get the minimum with the minimum total is 384 sample.
How sampling being conducted in your research?
I use the inclusion and exclusion criteria.
I mean, is it spontaneous sampling? Is it random sampling? Random sampling. Because if you did random sampling, supposedly you will not get such limitation. And then one more thing, because this is your single population is a non-public public hospital. Maybe it's more appropriate for you to put in the title
Supposed to
this
have
is
previously
more representative of your population.
Okay, next presenter, I would like to call Miss Hidayani.
Good afternoon, everyone. I'm going to present my our research, which the title of our research is Mapping Research Themes and Future Direction in Hydrotherapy on Menopausal Women, a bibliometric and content analysis. The objective of this study are to provide a comprehensive overview of hydrotherapy research for menopausal women and to identify key research themes, trends, and future direction. The research is based on the existence of research gap, among others, where the limited bibliometric analysis on hydrotherapy for menopausal women, and then it's need for systematic mapping of research themes and future direction, and then insufficient studies integrating hydrotherapy with other intervention. The finding summary of this research is we'll see the publication trend on hydrotherapy for menopausal women. So the notable fluctuation over time from 1955 to 1977. Publication were sparse, averaging one until two per year, and picking at 10 publication in 2021. According to the result figure, it's too small, but the figure we're getting the key terms on this research, such as hydrotherapy, aquatic training, insulin, resistant non-drug therapy, metabolic syndrome, fibrinogen, bone loss, insomnia, blood pressure, hypertension, and diabetes. And then the emerging topics are hydrotherapy, aquatic training, bone mineral density, electromyograph, agility, and insomnia. Outcome from this research is to identify primary research cluster using bibliometric and content analysis, and then visualization of emerging and declining topics in hydrotherapy research, and then highlight gaps in research methodology and study design. The limitation of this research is where use data limited to Scopus Index journals articles, and then exclusion of non-English publication may impact comprehensiveness, and then it need for real-world clinical validation of findings. The future scope of the study is integration of hydrotherapy and other modalities, combining exercise, dietary intervention, and medication, and then longitudinal studies assessing long-term effects on bone health and metabolic function, personalized hydrotherapy programs, tailored the approach for different menopausal symptoms. Conclusion of this research is hydrotherapy is a promising non-drug intervention for menopausal women. Research is evolving with emerging themes in biomechanics, metabolic health, and rehabilitation. And future studies should explore integrated approach and long-term impact. Thank you.
Thank you for your very interesting finding, I think. So from this research, what do you think the most searched things from this meeting? The most searched thing under this topic?
Tema.
Yeah.
The key theme ini temanya adalah hydrotherapy, aquatic training, insulin resistance, non-drug therapy, metabolic syndrome, fibrinogen, bone loss, insomnia, blood pressure, hypertension, and diabetes. It's still the trends of the newest publication.
So, what's your opinion on this thing? Why do researchers still involved in this thing?
Because in menopause, in menopausal women, it's lots of them. Climacterium is not a pathology, but normal transitional period that lasts several years. But the climacterium in this heat themes is apa namanya? uh, higher maybe higher in menopausal menopausal
Actually, insulin resistant may have some association in this.
Pardon?
How actually insulin resistant? How they actually associate with menopause? Insulin resistant. From your readings in your review, how this insulin resistance actually
influence
in-
the
associate?
menopausal. In the description result, the publication trend is in the right up there. There is it's found that the publication on menopausal is trending on the topic of menopausal. Okay, thank you.
Next presenter, I would like to call Ms. Rahmi from the
Okay. My research department self-diagnosis behavior toward mental health in final year student. Currently, many phenomena are occurring, one of which is the trend of self-diagnosis in health teenager. The impact of self-diagnosis is very bad for mental health. Mainly, it can increase excessive anxiety and trigger feelings of depression and create excessive fear of going to a more expert place. This type of research is quantitative using descriptive correlation research design with a sample size of 66 respondents obtained using probability sampling technique. Mental health is an important aspect for the process of human growth and development. The problem is that many people still think that mental health is not comparable to physical health when in fact physical and mental aspects go hand in hand and have their respective impact. When we are in a physical state that is lacking, our mental will also be impacted and vice versa. Mental health issues have long been a topic of discuss. In 2015, it was recorded that worldwide as many as 3,000 to 22 million people are estimated to suffer from depression and 2,000, 200, 264 million from anxiety disorder. The researchers want to look deeper into how self-diagnosis behavior about mental health in final year students in the Faculty of Health and Informatics at the Biologists Health Institute. For one of the protective strategies owned by individuals who feel mentally disturbed so that they can increase knowledge to go to the right health services and no longer self-diagnosis themselves and learn skills that can support or help people who experience mental health problems. Research method, this is the research method, research type and design. The type of research used is quantitative, which is type systematic research related to phenomena and data collection that can be measured with statistics, mathematics, and computing. In quantitative research design, there is a type of descriptive quantitative correlation, which is a type of quantitative research to measure the presence or absence of relationship of correlation of two more or more variables. Research location. The research location was carried out at the Faculty of Health and Informatics, Biological Health Institute, Pekanbaru. Research time. The research was conducted from January to July uh, 20, 2024. Research objective, first, general purpose, to find out how self-diagnosis behavior about mental health in final year student at the Faculty of Health and Informatics at the State Payung Negeri Health Institute. Two, specific objective, to determine the relationship between knowledge and self-diagnosis before in final year student. Two, to determine the relationship between attitude and self-diagnosis behavior in final year student. Three, to find out the relationship between gender and self-diagnosis behavior in final year student.
I think can
Skip?
yeah, skip.
Okay. This
This is the results.
no.
This is the results.
This is the result.
Just what you mentioned.
Okay. This is result based on the result of research that has been conducted in July 2024 regarding self-diagnosis behavior toward mental health in final year student of the Faculty Health and Informatics Institute Kesehatan Payung Negeri Pekanbaru. The research was located. Okay. Okay. This. Skip.
Next.
Okay. Okay. Okay.
Just one line statement. Just finish.
Okay. There is no significant relationship between knowledge. There is a significant relationship between attitude. Third, there is a significant relationship between gender. Okay. 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 And continue. B. Advice. It is hope that during this study in the future, students will no longer self-diagnose themselves if they feel that they are already experiencing symptoms of mental illness. It will be better to do so, to go to exciting health services for more accurate results. Okay.
Skip. Yeah.
Thank you. Okay.
Which of the behaviors do you think that is the most influence in your study? Which behaviors actually give the most influence?
Self-diagnosis behavior about mental health. Uh-huh. For the student final years.
So from your analysis, what kind of behaviors of this self-diagnosis?
Um, because pressures of academic, they are overthinking and there's diagnosis themselves. Oh, I'm mentally health was disturbed. Okay,
So mostly because of that.
yes, final student. Okay, okay, thank you. Let's move on to the next presenter. Okay, thank you, Miss. Yeah. So, students, please keep your presentation to 5
The
minutes.
next presenter, please welcome Miss Yuni.
I think anyone would like to have tea or coffee, you can go like one by one. He's going to get the coffee. Thank you.
Fotonya nanti.
Video? Itu dulu. Biasa-biasa ini.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. My name is Yoneta Octaviani, and my little research about application of acupressure to reduce the risk of hypertension complication in pregnant women at Puskesmas or community health center. World Health Organization systematically evaluate maternal mortality worldwide in development country. 60% of maternal death are caused by hypertension. Data from the Ministry of Health show that number of maternal death in 2022 caused by the three main causes of the maternal death. First is bleeding, hypertension, and infection. Hypertension is a disease with high prevalence, and the number continues to increase every year. The large proportion of hypertension cases come from developing countries. Hypertension in pregnant women is influenced by several factors: age, nutrition, twin pregnancy, and anxiety. The result of the study by Robert et al. State that depression and anxiety is early pregnancy are associated the risk of pregnancy. One of the non-pharmacological therapy methods that can be applied. Okay. Objective, the purpose of the study was to see if there was an effect of acupressure therapy on lowering blood pressure on pregnancy women.
The research method is the type of research quantitative with a quasi-experiment research using one group pre-test and one group post-test. The population was all pregnant women hypertension sufferer who came to the health center. A sample of 21 people was determined by purpose sampling. The study was conducted on November 11 until 60, 2024. And the result is in bivariate analysis. The results show that the p-value was smaller than the alpha value. So it can be concluded that there is a significant difference in the average systolic diastolic pressure before and after acupressure intervention for the woman pregnancy. Just it. Yeah, thank you.
Okay, from your finding, do you think that this
Acupressure.
acupressure is actually effective to reduce the hypertension?
From my research, yes. So effect. Not so much effective, but effective.
So, because you didn't actually mention here the average of your systolic, so we actually can't really see your the mean of your systolic pressure. So maybe it could be 140 average, and then it reduces to 135. So it's going to be maybe
The presentation.
yeah, maybe it's we call significantly decreased,
okay.
but it's actually not really effective because it's still there, the hypertension, isn't it? So maybe my advice is maybe you could also include in the in your in the results the mean value of the systolic pressure, so that we can see whether it's actually effective or not, rather than just putting statistical, yeah,
Oh, yes.
it's not.
I'm sorry, but yeah, untuk the table, I can show in there. So because I just aku hanya bawa yang ini presentasi gitu maksudnya. Yeah, but maybe my participant just 21. So I think this berpengaruh gitu.
But it's actually very small sample.
Yes. So maybe in next year I must smaller. Bigger.
Yeah, you need to increase your sample population.
Yes.
Okay, and then one more thing. This acupressure, could you actually describe more which part of the body you actually apply this acupressure?
Oh iya. Oh sorry, in my abstract nggak ada. Jadi sebenarnya untuk acupressure point, the pressure have 5 point, acu point. But in my research, I just menggunakan use 3 acu point in this one, in this one, and in this one. Because I and so maaf karena keterbatasan waktu untuk masuk sini.
But I think it's very interesting.
Okay, thank you. Okay, next presenter, please welcome Miss Mera de Lima. Lagi keluar nih.
Mira dari mana?
Tadi ada. Okay, maybe we can call next presenter Miss Astri Safari.
Assalamualaikum. Good afternoon, everyone. My name is Asri. I'm a university student, and then I work in the Malaysia, Indonesia. My title is Enhancing Maternal Satisfaction and Well-being: The Impact of Advanced Home Care Programs on Postpartum Recovery. The postpartum period is a critical phase for mother's recovery and adaptation to motherhood. Postpartum challenge is the physical change, emotional and psychological adjustment, and risk of postpartum depression. A common gap is lack of adequate support for the new mother. Solution may be
sit down here,
solution
but,
advanced home nursing
after-
program is holistic
I don't see her.
approach. Um, this is the US viewer. If you look at my PPT in this area, everyone can look this postpartum care and mental health are usually recognized as vital areas of research. Pure X with US viewer maps for hot key themes and trend in postpartum health studies. Note repression frequently study concept with larger notes like postpartum depression, mental health, nursing, and social support. This is the area, the blue area. There's the gradient blue area is some people to research, many people to research, and then the yellow area is like so how research has evolved over time. With yellow height, yellow height. This is network topic. Key insight include the role of social support in reducing depression in the positive impact of nursing intervention, and the importance of addressing anxiety and mental well-being in postpartum mothers. Is strong link between concepts such as postpartum depression and social support, highlight the critical interconnection. This analysis stresses the importance of a holistic approach to postpartum care, combining physical and mental health strategies to improve outcome for mothers. Research objective to evaluate the impact of advanced home nursing program, like postpartum mother satisfaction and well-being. Postpartum mother satisfaction, personalized service, comfort, and emotional support. Well-being is like physical recovery, emotional stability, and psychological adaptation. This study evaluates how home care program affect postpartum maternal satisfaction and well-being by addressing their unique needs. Maternal satisfaction is strongly influenced by the quality of personalized care and emotional support provided. Research gap. This research seek address the gap in understanding the advantage of home-based postpartum care compared to institutional services, especially within the Indonesian context. As noted by Khidir and Ahmed, 2022, there has been limited exploration of how home care program influence patient satisfaction
Research method design a descriptive correlation with a qualitative approach. Sample is postpartum mother who received home nursing care within 1 month post delivery. Make a purposive sampling instrument, make a structure and semi-structured questionnaire, and then analyze manual thematic analysis and data visualization using make a VOS viewer and regional context focus on Indonesian culture for relevance and local contribution. Research finding benefit of advanced home nursing program, reduce anxiety and postpartum depression levels, increase satisfaction through personalized attention and education, faster physical recovery, and comfortable home environment, emotional support from nurses, enhance mother's confidence, and then what is changed this result is high cost barrier to broader implementation, and then recommendation for my country policy reform for better accessibility, especially for nursing, because we know in Indonesia we have to focus to mother. Postpartum is not only nurses, but yes, and then maybe we must to contribution for the postpartum, and then the KFNB home nursing program significantly improved postpartum mothers' satisfaction and well-being. Emotional and personalized support from nurses reduce anxiety and the risk of postpartum depression. Critical analysis, the strength, holistic approach, personalizes care, and faster. Okay, is that okay?
It's a good study. Thank you for the presentation.
So I have a question, like, how do you think the home care based nursing services can improve the mental health?
Because the nursing is the multi-talented intervention. And then we not only do physical intervention, but we must because I'm a mother, I have to pregnant more and more, and then we have every mother needs to support not only the nurses, but we are nurses is only just to educate and then to facilitate the family nursing, and then husband and then other family can support the mother, especially postpartum time.
Considering the mental health care, maybe you could consider the nurses if they require any certification on the psychological perspective.
Yes. Yes, psychological perspective. Yes, but I'm focused on postpartum period, only the postpartum period, because we to increase the postpartum blues or postpartum depression.
Yeah, because the term postpartum depression was
Yes.
there, so that's why I asked, because with this home care based nurse is becoming more prevalent among maternal after the post delivery. So I think it will raise the
Every data we have only the physically of the postpartum, and then about the mental health, and then about postpartum depression is very small in actually in my country. of the focus on my village in Bogor is I didn't have data of the postpartum birth, and then maybe the mother he can talk because she's only lonely, feel lonely, or it's like I want to talk to anyone, and then the only one to.
But I think what's the difference between home visit, current home visit with advanced home visit? What is the difference between home visit and visit?
Yes, of course. Because this is not only the physical. We on because the nursing is more like to practice not only to physically focus, but he must our nurses because in my I feel the nursing is not to focus the mental. Yes, they all be physically, but especially in my country, nursing is the assistant for doctor. Only what the doctors do, and then I want he have to independent nursing, especially for the mental health, especially to postpartum mother.
I think we are taking a bit more time. Yeah, thank you for the presentation.
Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
So thank you, please now, please be ready.
The next presenter, please welcome Miss Mira Delino.
Yeah, Captain, you want to talk one by one and go and finish. How many left? Four.
More than that. Yeah, we are fasting it. Please limit your, please be fast in presenting, 5 minutes.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Hey, down here. Hello? Speak loudly.
Kita is teamwork provider professional in the implementation of interpersonal collaborative atmosphere. Backbone, interpersonal collaboration or is teamwork between professional. IPC is the key strategy for efficiency, quality of patient care, and patient satisfaction. Study and knowing the description of the collaborative service between professional care providers or PCP in implementing a professional collaborative activity in the hospital. The gap in this research is there is a lack of evidence regarding the effectiveness of sustainable APC training programs.
especially in developing countries with limited resources. Lack of understanding of how contextual factors such as organizational culture, professional hierarchy, and resource influence NPC success. Limitation of research exploring patient and family experience related to the effectiveness of APC. There is a lack of research identifying specific policies or management models that can evoke interprofessional collaboration. The methodology of this research is, I'm sorry, the summary of this research is interprofessional collaboration in the hospital has not been running optimally. The clinical competence of nurse in supporting collaboration has not been met. Most caregiving professionals still do not understand the concept of interprofessional collaboration. The participation of pharmacists and dietitians in the collaboration process is still limited. The dominance of collaboration include among doctors and nurses. Other professions are less involved. The result of the study indicates that the interprofessional team and collaboration team at Bukit Hospital are not optimal because the pharmacist profession participation in collaborative care is still minimal. So, joint visit activities involved in the fourth profession have not been carried out optimally. I'm sorry. The human resource of the pharmacist and dietitian profession need in carrying out collaboration are not sufficient in terms of quantity and quality of competence. The dominance of team collaboration is right. The limitation. This study only involved two important form for profession. Doctor, nurse, pharmacist, dietitian, which might not represent a hospital condition. Focusing only on one hospital, the result of the study might not be generalizable to other contexts.
Skip this part. Okay. Because it's already more than 5 minutes, already 6 minutes. Yeah, I need to have others to present. Yeah.
Conclusion.
You have a question? Yeah, please ask.
Okay. Thank you. Assalamualaikum warahmatullahi wabarakatuh. My name is Abdul Haris. I am interested for your research because your assessment for the interpersonal collaboration. Interpersonal collaboration is main problem in Indonesia because our services is not maximity to give the caring for our client in hospitals. So I will be to say for you are what the main challenge in the implementation for interpersonal collaboration and how they overcome of that. What is the main challenge in implementing IPC?
I'm sorry, repeat again.
What the main challenge
Okay.
in implementation IPC?
Okay.
Yes, and how to overcome of that.
Please ask.
Okay. Thank you. will try to answer it. The challenges are the lack of understanding of IPC, the lack of pharmacists and dietitians, and the lack of training. The solution is IPC training and big health worker and train hospital policies.
Per worker collaboration.
Okay. I'm sorry,
No problem.
Yes. I'm sorry.
You answer it, okay, no problem. You can learn from this.
Okay, thank you.
Thank you. Thank you for the presentation. Can always improve, no problem. Yeah.
Okay, next presenter, I would like to call Muhammad Sif Azhar.
Assalamualaikum and good evening. Right, my topic is on assessing the provider quality of information system and implications for economic sustainability in Malaysian public hospitals. My name is Azhar, and this is my presentation outline. And just a bit of introduction. Hospital information system is a computerized hospital, meaning you have computerized system in the hospital. And from the literature, it is supposed to improve patient care, you have efficient administration and resource management. Besides that, it's also supposed to integrate all clinical functions in the hospital, A to Z, from registration to ordering medication and so on. And it also plays a critical role in enhancing green practices in hospital operations. So the effectiveness of this system often hinges on the quality of encompassing system functionality. Because in Malaysia, the HI system is provided by a third party, a vendor. It's not by in-house hospital management or ministry. So as mentioned earlier, it is provided by the external vendors. So the quality of HI system that is provided actually would impact the usability, user satisfaction, and net benefits experienced by the staff. So the level of quality, whether high or low, would influence the overall usage of the system. Thus, the challenges or the gap in this research is actually to assess the quality of the outsourced HIS in achieving sustainable economic outcomes. Because ministry has invested a lot, berjuta-juta, millions of ringgit to get the system into the Ministry of Health Hospitals or public hospital. So objectives is number one, to assess the quality level of outsourced HI systems. Number two, to identify the differences in quality across different hospitals. And number three, to assess the level of usefulness, satisfaction, and net benefits of the system. Just a little bit of literature review. There was a recent study in 2017 reported that in 4 hospitals in northern Malaysia, there was a partial failure in the system's use. They quoted that many of the modules were not used, and they are unable to integrate between the nursing module to the lab module, pharmacy, and so on. Another study by Lee, Ramai, and Zakaria also noted that staff motivation or staff usage is a challenge in using the system. There are also many foreign literatures which also quotes many challenges in using the system. Okay, and Burke in 2001 says that systems in hospital is a very complex environment as compared to other industries, right? Right. This my PhD study looks at a theoretical framework. There is one theory that we looked at called agency theory. Agency theory links between the provider, which is the agent, the vendor, the system provider, and the government or the hospital. So when we engage a provider or vendor is supposed to provide a good system to the government, right? So this is called the agency theory. So the research will look at the quality provided by the vendor, and these are the variables used to assess the quality of the HIs, right? Okay. So actually, my PhD study is a mixed method study, right? But for this purpose of this presentation, I only talk about the quantitative. So an adopted questionnaire was used, Likert scale 0 to 1. Each because we took multiple sites of hospitals in the country. So each site there were 250 because I use structured equation modeling. So the sample size needs to be more than 250. Random sampling, we use stratified random sampling using a sampling frame across all the staff, because there are many users of the system in the hospital. There are some inclusion and exclusion criteria, and for the purpose of this presentation, I will only touch on descriptive analysis because phase 2 is a qualitative analysis of the study. Alright, so this is just some demographic profile of all the respondents. Okay, basically the quality though, there's 3 dimensions to it: system quality, information quality, and service quality. System is a system itself. Information is what information that you get from the system. Lab result, X-ray images dan sebagainya. Service quality is the vendor punya service to the hospital. So the mean rating given by the staff is merely just above average, but because the Likert scale is 0 to 10, so rata-ratanya staff ni they rate between 5 to 6 saja. So it's 54 to 62% saja. And if I divide across hospital, there is some hospital which actually scored very low in the system quality and information quality. Very low in this hospital here. These are some in terms of usefulness, the variable usefulness. Also rating just above average. If by hospital pun sama. User satisfaction also just above average. By hospital also the same. And net benefit just a little bit better, 70-odd%. And the benefit overall which the staff rated, and by hospital also the same. When we do a mean post-hoc analysis and we divide, we noted that actually half of the hospitals actually fall between just above average rating of mean, which is significant. Right. So berbalik pada agency theory tadi, if you talk about sustainability, if the government has invested a lot, so 50% of the hospitals got a mean value of just 5.8 saja. Very low satisfaction rate. Okay. There is loss of control, meaning that we expect a quality but we don't get the quality. So government has lost control in engaging the vendor. And there's also some ethical and social concerns. Ethical meaning we appoint you as the vendor. Ethically, you should provide us a good system. But however, the staff have rated it as such. So further discussions, if you talk about sustainability, probably in future, government should look at probably not only getting vendors to provide the service, probably we should look at technology transfer. They should train our staff. Okay, or we should start developing talents within the ministry to be able to come up with own systems for the ministry. Okay, should the government also look at different approach or strategy? That's also another consideration. Then of course the ROI or return of investment. Okay, so conclusion, the economic sustainability of outsourcing is not simple, all right? Because it cuts across different industries as well, and of course the ethical concern is something that we need to look at if we need to look at sustainability as a whole. So with that, I conclude my presentation, and if there's any question, I will be happy to take them. Thank you.
Okay, it's a good presentation. Congratulations, because today we learned about this HIS. And then I just want to touch on the topic, because your topic is more to provide quality, but in your presentation, there's no assessment that you did on provider itself. So it's for me, it's quite misleading topic because it's not. We are not assessing the provider, but we're assessing actually the satisfaction of the user. So it's. I think overall the topic is quite misleading. Okay, but overall the presentation is very good. Yeah, of data is very good, I think. But, and then this the HIS hospital that you choose, this is the full HSI implementation or they actually not full implement the HIS?
All implementation.
So all these hospitals that you choose actually now using the full system,
Yes.
meaning all integrated.
Yeah.
Okay, from your finding, do you think that, may I know about your sample? You choose your subject. Is it based on what criteria? Because I could see that it's more, can I see your inclusion and exclusion criteria? Okay, so this is more to officers, and then but the one that will use the system itself is mostly the operators. You see, in the lab maybe the lab staff, but you see here, for example here, you actually okay contract permanent, but we don't know who is the user. Okay, so maybe but you exclude in here the IT officer, the house officers, but maybe it could be in here the lab managers. Yeah, so the lab managers, isn't it? So it's going to be different satisfaction.
May I interpret?
Yeah.
Do you have any question?
Yeah, this is the question. So because of you have different, you need to actually put your data maybe stratified into different level of profession because different level of profession, of course, they have different satisfaction. That's my question. That's my suggestion.
Thank you. Thank you.
Please restrict two question only. No for discussion. Discussion you can do later on. Let them present and just you have any query or if you don't have any question, just make question.
So,
Discussion later. And next, last two presenter, please go to Palwan 7 and 8. Last two presenter.
last presenter will be
Who last
Zingkong
presenter?
Liu and Ratna Devi.
Okay, please come. Please come.
Zingkong Liu and Ratna Devi, please follow Professor Sandeep to the
Other room.
room. Only Palawan 7 and 8.
Only limit two questions.
Okay,
No discussion.
thank you.
Okay, next presenter I would like to call Miss Mila Sabina. Assalamualaikum warahmatullahi wabarakatuh. Relation to communication strategy for optimizing independent and quality of life among the elderly in the community. Systematic review. Okay, introduction. The elderly face various challenges in maintaining independence and quality of life related to physical, psychological, social, and economic change. Then, after this, to physical and mental decline, as well as reducing social functioning, making it difficult for the elderly to adapt to their environment or even their own family.
Relational theory-based communication strategy emphasizes the importance of interpersonal relationship and effective communication in building emotional support, trust, and motivation to remain active. Methods. The system review was conducted following the Prisma guidelines, such as performance across corpus database for study published in 20.
So we continue. Whatever. So now,
No.
are you cry?
Everything fine? Okay.
Are you
Yes,
okay?
I'm fine.
When we cry.
2010 and 2024. Out of 446 identified articles, 12 articles at the inclusion criteria for review using the specific keywords. This is my Prisma Adelaide. This identifikasi data collection Scopus database di using keyword, degree and quality of life and communication strategies and independence. Then screening was carried out from 446 data articles about the subthread thus that did not meet the criteria amounting to 436 articles, so that a full text review was obtained. Normally, then article include which were the data collected from the literature review. And conclusion, the literature review discussion relation theory-based communication strategies which have great potential in enhancing the independence and quality of life (TOL) of the elderly in the community. So this approach meaningful interpersonal relationship between the elderly, the family, the community, and healthcare professionals become the key to supporting the well-being of the elderly. However, although many studies emphasize the importance of interpersonal communication in improving the TOL of the elderly. Most studies use cross-sectional design. The elderly provide a snapshot and therefore cannot draw causal conclusion. The gap is still exists in this research lies in the lack of longitudinal study that can uncover the long-term impact of relation theory-based communication on style change in CRL and independent of the elderly. Thank you.
Excuse me. Yes. Thank you. Thank you for this time. I interest to this presentation. I want to ask you about.
Yes.
Okay. I want to ask you about what's your plans in the future to the relation-based communication for your research.
Yes. In the future research, we'll use longitudinal research design, but this research allows research to explore in the how meaningful interpersonal relationship can feel sustainable change in the quality of life and independence of the elderly.
Okay, thank you.
Okay. Mrs. Mila, I see for your articles is so many to source for your literature review, but I don't find what is your criteria to choose the literature with your what is your criteria to choose to use for you to your article selection process.
Okay. Uh, okay. The criteria used to determine the eligibility of relevant were inclusive criteria study period between 20 2019 and 2024 and study in the final publication batch publication in the English language document type article and review and exclusive criteria. This is publication in language
Yes.
other than English, the thesis, dissertation, book chapter, and conference paper and lay literature.
Thank you.
Thank you for the presentation. You did a good job. Thank you. Okay, next presentation.
Oh my God. The next presenter, I would like to call is Justitiana.
Thank you so much, everyone. I would like to introduce myself. My name is Dr. Justitiana. I'm from Indonesia, medicine, University. Today, I would like to present about my presentation about the diet and supplementation, a strategy to lower cholesterol level and treatment high fat diet on reduced obesity in the sugar-way rates. Actually, it's a big project from our team. We combine obesity this years, and we still have to find how to contain the obesity. After that, we focus about how to find strategy, the new strategy to make the obesity decrease over the years. And also, we have the topic today about the diet. That is like buffalo milk from the fermentation from the buffalo milk, and then we make kit. It's like a yogurt, and it have the effective for inflammation, anti-inflammation. And also in the study, we use the mineral. We use the zinc. We know the zinc is like important, crucial mineral for our body. It's also as anti-inflammation. And the problem statement, we know that how the advantage of diet with zinc to get the obesity. And from the research objectives, we do from the study, we do the in vitro study. We have the around six the control, six group, and then there's in the group one no diet, group two high fat diet. Is the animal experiment. After that, we use the group with the animal experiment and the rate for the 6 months until 12, 6 weeks until 12 weeks. After that, we treat the group with a different treatment with hyper diet daddy, hyper and zinc, and hyper diet daddy and zinc. And then after that, we check the cholesterol level, pre and the post treatment. And then we're gonna see what happened after that. And then location of the research we do actually it's a big project, it's small of the part of my research. So it just focus for the cholesterol level. And then after we treat the group with the different treatment, we can see any change from the body weight, pre and the post intervention. And also, we find the cholesterol level from the group is also lower. We can see the best change when we give the combination of daddy and zinc supplement, and it's very have a lot of significant, and he and it's if the relationship and daddy and zinc when they treat together, and then the cholesterol level is more lower and lower. Uh, After that, we make a conclusion if if we give the daddy as yogurt, treat the obesity of the animal experiment, it give the positive impact. And when we make the combination, daddy and zinc is make lower of the cholesterol level. So I think it's the good maybe the good strategy for us. We know that sometimes the patient don't want to eat to take the pill longer, and then we can give the suggestion to like prevention, and if they can take a yogurt in daily life, and then also take a vitamin to decrease the cholesterol level. I think that's all about my project. Thank you very much.
I think it's very interesting topic, but why Delhi? Is it the vehicle for the zinc?
Daddy is the buffalo milk, and we make the fermentation for 2 or 3 days. After that, we incubation in the normal the normal room temperature, and then after that we it's like a yogurt. Actually, it's like a yogurt. Look like a yogurt. Yeah.
So what's the idea with it, by using daddy? Because we know that we are testing in bread, so they actually we can actually just introduce zinc. So
Why I want to mix the daddy? Because daddy we have to it's the part of the my big project or my university, and then we make like a biotechnology project. So we focus to explore about the yogurt from my town, and then we want to export. And another reason is have done, and we have the result about the daddy have the potential of the anti-inflammation like inhibitor, TNF alpha, and all the anti-inflammation, and decrease the blood glucose. And after that, because I'm a master of nutrition, so I think about how to make the idea to impact to make the obesity and effective to treatment the obesity. After that, because Z have the effective to the appetite and work in our mind, and then it's work at the leptin signal. So when we treat the idea and Z, and it will be effective to make the appetite lower. So the problem why the people get obesity is about the leptin resistance, of course, resistance to insulin. So when you give the zinc, and then yeah, it could help decrease appetite, decrease signal leptin, and make it more sensitive about the leptin.
Do you think that maybe inside the daddy there's any other peptide that also could contribute? That's why when I ask this question, I'm not for you to think that maybe this effects not alone by the zinc itself. Maybe it's
Yes,
because of
it just
effects.
it's just like induce of the bacteria. But bacteria can work alone without the zinc because I've many project about that. But as we know that I learned too much about the yogurt, so it can change the diversity of microbiome of our gastric. It could help if you have the microbiome, normal microbiome is normal, and it can make your insulin sensitive and also leptin sensitive. At the point of the disease.
But very good, I think very good results of research. It's just that
It is
this
one step.
question, yeah,
We have
why?
the full 5 step actually. It is one step that I try to present. Okay, thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Okay, next presenter, please welcome Ms. Z. Chen Lin.
Hello, everyone. My name is Xie Li. Started to investigate cause those that give financial institutions fix management and control systems. About the check in loop systematic celebration, escalation, assessed via urgent practice and stuck models in the revision of that and its strategic application. The research examines influence of financial institutions and risks that set as the field related of quantitative was not the gist. Is the element of the problem in the mid-20th century, financial institutions began to employ basic compute technology for administrative purposes and market in of fair. Objective of study. The study aims to uncover improvements that brief and design making sure that the same how the design and the operation of fairs straighten info hold ability to include and beauty the data. Conceptual framework research method, knowledge, sampling method, and data collection. Next, risk discussion. Thank you. Nisha?
One more.
So, actually, you need to get any tool from your government to do this research because it's actually you trying to learn about their institution, isn't it? So there are secrets, ethical issue. How you get actually approval from the government to do this research? How you get permission from China government to do this research?
It has financial institutions influence risk management outcomes with represented the ultimate objective of project.
So are you looking at government sector?
Sorry. Thank you.
Okay, thank you.
Okay, our last presenter, I would like to call Miss Ju Minzia.
A study to understand and intervention in the use of technique for merging and the Christendom of China. A bit strict, this study explored the impact of emerging technologies on knowledge management, information sharing, and the knowledge production across industries in China. Interesting the big data context, it is the research in course, next month. Statement of the problem in China harmless, warless, leadership style, or built how knowledge management of products are used and houses for their objective of study. Learn has both traditional and transformation management skills, among others, impact KM, adaptation, implementation, and success in Chinese organism still central. Objective of study, analyzing how leadership affected the culture of KM, a process, identifying key change faced by Chinese learning in every KM technique. The use of leadership technique, knowledge management in the Kingdom of China.
research methods, a quantitative technique was plotted by the researchers. Random sampling was imposed with protected content for social components. Primary data gathered with wide quantitational the relationship between knowledge management KM in China and the leadership technique with annual year. Leadership skills in China are influenced by cultural factors. For dependent years, the demonstration skill of leadership was most effective, followed by education and democratic skills. The study postulated that stability, political climate, cultural norms, and other commutative specific factors similar to culture imitate the information of leadership skill on TM. Okay, thank you.
May I know which sector you actually study on? Which sector? This one, a government sector or private sector? These leaders, they're actually looking in which sector?
A study to China understand the leadership.
The leaders are government or private?
Yeah.
Government?
Yeah.
Woman?
Okay. Thank you. Thank you very much.
Okay, thank you to all participants who did the presentation today. Okay, I would like to thank also to our two dedicated chairperson for their contribution. And I would like to call two chairperson, Dr. Zaleha and also Dr. Jayasri, to receive the certs and also the token of appreciation. Madam, please, the chairperson. Sorry. Okay, please welcome Dr. Jayasri.
Thank you.
Okay, thank you everyone.
Participant certificate.
Tomorrow. Closing ceremony.
Close.
All presenters, please with the chairperson take photo. Chairperson come in front. Group, please, all presenters, please come here.
Afternoon. 4 o'clock.
Yes, please go that side. Come, everybody come.
Come take photo.
Come. Chairperson in center. Listen off. Record. Off.
And the stream.
Off. Stream close.